We'll wait 2 more minutes.
I think Dr. Panda is also is joined, so just check that.
Okay, great.
Hello, Dr. Panda.
Hey, good evening from here.
Yeah, good evening. Good evening. Yep. So I think Swarnalok and Subhadeep is going to organize. So they are going to talk about the presentation and everything in detail. Yep.
Sure.
Thanks.
Hey, good evening from here. Yeah, good evening. So I think Swarnalok and Subhadeep is going to organize.
We'll wait 1 more minute. After that, we'll start.
Hello, everybody.
Hello, Asim.
Hi, Asim.
Hi, good to see everybody.
Yeah. Just to let everyone know, we are live now. So, Swarnalok and Subhadeep, you can start the show.
Sure. Okay, I think looks like we have everyone here. Hello, everyone. Firstly, good morning, good afternoon, good evening, based on which part of the world you are joining us today. Welcome to SciROI Global's first webinar in 2025 within our focus webinar series on the topic of wearable technologies, current trends, progress in India. We welcome all of our participants for attending this webinar and wholeheartedly thank our speakers, panelists for accepting our invitation to join us today. I'm Subhadeep, currently working as a senior scientist in the field of drug delivery or formulation sciences at the pharmaceutical company Merck in Boston, Massachusetts. I had served in SciROI in 2021 and currently also an active volunteer member of SciROI Global's 2025 leadership team. Through this webinar, we will learn from leading experts working in this emerging research field in premier academic institutions and also in industry, and gain insights about career opportunities in India and engage in meaningful discussions with our panelists in the follow-up Q&A sessions or by panel discussion. I'm accompanied by another SciROI volunteer and the leadership team members, Swarnalok. Swarnalok, if you want to go ahead.
Okay, yeah, thank you, Subhadeep. And hello, everyone. I'm Swarnalok, postdoc in the Department of Chemistry and Material Science at Aalto, Finland. As many of you already know, SciROI is a volunteer driven non profit organization that was founded by Professor Asim Ansari and the Win Step Forward 2015 with the mission to create awareness and aid in the smooth transition of the Indian STEM diaspora back to India. Over the last few years, SciROI has provided a platform for promoting multi level collaborative initiatives between individuals and agencies in India and abroad in facilitating the pursuit of a STEM career in India through our annual events, recruitment drives, focused webinars, podcasts, blogs, and newsletters to highlight the diversity of prospects in India. To know more about our past activities, here is a short video. Okay, so without further delay, we'd like to start today's webinar with a brief welcome address by Dr. Ansari, the founder of SciRoy and currently faculty and chair of the Department of Chemical Biology and Therapeutics at St. Jude Children's Research Hospital, USA. Asi.
Thank you very much. This is always an honor, and I'm always amazed every year as I see SciRoy, the volunteers that have engaged take it to places that we had just never imagined. Identify needs and build things that address the needs of the community in real time, very agile and impactful. But I should start by thanking everybody. I should start by welcoming everybody to this today's first boni, as they used to say when I was in Bombay. The first event of the year. And there are many, many events that they've planned, but welcome to the first one. And thank you for coming. And I'd like to thank the speakers for sure for contributing their time and their expertise and sharing it with people who are interested to build their own careers, learn more about what is going on, learn about the challenges as well. It's not all rosy, the universe, as you know. You need to know the ground truths to be able to engage effectively. So I thank the speakers for bringing their expertise and giving their time. I thank the participants for coming, and they will continue to come. We are Indian, so we'll continue to accrue over time, just a few minutes past deadlines, right? But more than anyone, I would like to thank the volunteers. So this is a volunteer-run organization, and its history starts in 2015. And its roots are actually in a Guru Dakshina type thing that we started to honor the people that have laid the path ahead of us. So people like Govind Khurana, Ved Siddiqui, and others who laid down the path, Bose, for instance, S.N. Bose, for my generation to be able to build their careers. Khurana program started, and you can sort of see that here, in 2007 at Wisconsin, where Govind Khurana won his Nobel Prize, did his pioneering work and won his Nobel Prize. And so to honor him, we started these undergraduate programs where students would come from India and work in labs in the US. American students would go to India, mostly in the biomedical sciences, supported by both the US government, National Science Foundation, as well as DBT, that time Maharaj Bharan. From that humble beginning, of just bringing undergraduates over the years from 2007 to about 2012, 13, 14, students started to graduate. And around 2014, one of the students, Sriram, who's now a professor at Azim Premji, said, what do you do for people who graduated if they want to build a career in India? And thus started SciRoy. So it was science research opportunities, originally science and technology research opportunities in India, and also play on the term return on investment. So many people have invested in everyone's education. As these trained experts go back to India to build their careers, here's the return on investment. Over time, we lost technology, so it's now SciRoy. It used to be held in Chicago at the consulate and the University of Chicago for several years until the pandemic hit. And then once the pandemic passed, it started again. And this time I had moved to St. Jude. And so we did the first 2 years at St. Jude. This year, the leadership team has taken the bold step of trying 2 different venues. One is Washington, D.C., very close to the embassy, Indian embassy. And Debolina, I think, is the one who has organized that location. There we are the volunteers. And the other one is in Vienna. So yeah, can I go back to the previous slide? I'd like to thank people from last year. So every year, the event from Sriram, then Piyush and others has grown to include people who have given up their time, volunteers who said, you have built this, but I would like to add this particular capability. Why don't you do this? So SciRoy has become a platform, if you will, from the original goal to introduce people to policymakers and people who are looking for trained young professionals to essentially a platform. And every generation, if you will, per year, if I call them generation, has come in and contributed their thoughts, their energies, and created new facets to this particular organization. It has been incredible to watch. That's how I started my introduction. That every year I see something interesting happening. And now you're seeing 2024's volunteers who had built some of the aspects in Europe. Right? So you're seeing here Abhishek Acharya, who had started this our footprint, if you will, in Europe, being taken forward by Pallavi. She was there last year. She is now continuing this year. So the point is to say that this is an organization that responds to the needs of its participants. I invite people to identify things that I'm lacking. I invite people to bring their ideas and engage with the leadership group. And I would like to thank the group that has taken so much time. I mean, what you see today in terms of the webinar that's going to happen, I mean, the other events that are going to be laid out over the years, including the annual event in Vienna this year in DC, as I was just saying, takes a lot of work and planning. All of the volunteers that you're seeing here who brought last year's event and the volunteers for this year, if you go to the next slide, right? All of them have been meeting on weekly basis, every weekend, trying to figure out how best to position different topics, how best to invite experts like the experts speaking today, and how best to reach out to everybody and inform them of the opportunities and the growing trends in India. So over the years, we've had many volunteers. Volunteers stay for exactly 3 years. There's a specific reason for that, so that people can continue to grow. This first year, the volunteers in their first year build things. Second year, they perfect them. Third year, they transfer them to the next group of volunteers in the permanent. So 2024 volunteers have been very good. And then people who join this year from across the globe are welcome to build this and in directions that they find important and appealing. And I have a slide, this slide I had not seen before, but this is incredible to see how it is growing. So it originally started out in the Midwest, centered around Chicago. Now you can see the reach of various volunteers, teams across the globe, if you will, that are working very hard to engage and bring value to their peers. Right? This is not being done on any other basis than desire to learn more, engage, and enable others as well. So I invite you to stay in touch with the SciRI group um, and learn about all the events that they're engaging in. And even more importantly, I invite everybody who's listening, if you see something that needs to be done, come join the team and participate, right? So engage. We are very good in India. We're pointing out what needs to be done. Take the next step and come do it with the SciRI team. With that, I'll stop. I invite everybody to come to the annual events. These are in-person events in Europe and in US. And hopefully next time we'll do this in India for SciRI India for people that have gone back. So we can learn from them what their experiences have been, what their needs have been, and how can they be even more effective. Yeah, so he's pointing out to the dates when this is. September 10th, 11th in Vienna, and 13th, 14th in US. With that, I will stop. And I look forward to learning more about wearables. I spent a little time with Mike Snyder out at Stanford, and he was very much into wearables. 14 different sensors all over his body, shirts and bracelets. So I'm eager to see what is happening in India today. Thank you very much, everybody. Thank you for the opportunity to share the history of SciRI and one step forward. Thanks.
Thank you, Dr. Ansari. Thank you so much for your leadership to SciROI and taking it to its mission where we are contributing to. So with further ado, we would like to do some Zoom etiquettes. Before we go into our talk, I would request all the participants to maintain the following etiquettes for this webinar. Please keep yourself muted throughout the webinar. Please post your questions with your introduction if you can in the Zoom chat. We will try to accommodate as many as questions as possible in the Q&A session, which is the second half of this webinar. Please keep your video on for better interaction if you can. So we have today 4 esteemed speakers, and we would hear from all of them as this order from left to right. After each speaker's individual talks are completed, then we would open the floor for a combined panel discussion and a Q&A session with all the speakers. So our first speaker today is Dr. Siddhartha Panda, who is the professor in chemical engineering at IIT Kanpur. His research interests are chemical sensors for various applications, including healthcare. We welcome Dr. Panda to share his thoughts on this topic. Welcome, Dr. Panda.
First of all, I would like to thank the organizers for this invitation and this opportunity to share. And Dr. Ansari, it has been a pleasure knowing about the inception of Sai ROI. And as the saying goes, may the force be with the organizing team is very inspiring. And it is indeed, I feel very honored to be invited and to share some of my thoughts. So I have a very brief presentation. It's about 10 minutes. It just gives a snapshot of some of the activities which are going on. And by no means is comprehensive. But hopefully that will set the tone for the interaction that will happen after all the presentations are over, as was mentioned by the organizers. So if it's okay, can I go ahead and share a presentation?
Sure, please feel free to share. I'll stop share. You should be able to share on your end. Yeah, it's coming up.
Okay, I've titled the presentation Flexible Electronics, a platform for wearable technologies. And let me start with what is flexible electronics. Perhaps it might be redundant to several of you out here, but just to make sure that we are on the same page, I'll give a very brief introduction. If you can make any electronic circuit in a very, very flexible manner, and that's what we call flexible electronics. Today, when we think of something, when we think of a smartphone, when we think of even the monitors, what we have, most of them are rigid. But if these can be made, say, on plastic or cloth or even paper, then that's what we call as flexible electronics. And just to give some examples out here, these are the foldable displays. And there's also this foldable lighting, also solar cells, which are simply, like these are rolls and all, you can just take it out and put it on a backpack or somewhere else. And now these are RFIDs, which are made on plastic, and even ICs, integrated circuits, which can also be made on plastic. And then we see sensors. This is what I'm going to focus on. Different kind of sensors, some of which I've given here, pressure sensors. This is the glucose sensors, image sensors. All these are examples of flexible and printed electronics. And then if you look at the market, and this is a 2019 data, what we have, the total market is about 37 billion US dollars. And majority of the market share comes from the display sector. And about a little about 10% comes from the printed and flexible sensors. The rest of the market share is taken up by conducting ink, OLED lighting, batteries, OPP, and all. So this gives a snapshot of what flexible electronics is and where things are in the world market. And this is a relatively nascent field. And now let me talk about flexible electronics for India. Now, when we talk of electronics, as of the traditional players, of course, have been the US, and now it has been China, which has taken the manufacturing part of it. China, Taiwan. But then this flexible electronics opens up a new door for India. Why? Because if you look at the strengths of India, India is in the top 10 as far as manufacturing of chemicals are concerned. India is in the top 10 as far as printing is concerned. In fact, like what I read is all the Harry Potter books were printed in India and were shipped to the rest of the world. And when National Geographic was in print, these were printed in India and shipped to the rest of the world. That's a testament of India's printing capability. But what we do not have as much is, like, we do not have as much of electronic chemicals, and we also do not have as much of printing of electronic chemicals. But all the basic facilities are here. Now, if you look at India's economic backbone are the SMEs. And I have just some numbers out here. I'll not read through all of them. but that is where the strengths are. Now, if you look at flexible electronics, the capex as well as the opex are much smaller compared to that of conventional electronics. So, which means there's a huge opportunity that if one takes up this new area of flexible electronics with relatively limited resources, there's a possibility of coming up with products which can be taken up by the industry. And that is where the story is. But one good thing also has happened that India has come up with a semiconductor policy in 2021. It was announced. And as we speak, there are fabs which have been set up in Assam as well as in Gujarat, and more are on the way. And what we hear is that like the first chip is going to roll out sometime soon. So what this has done is this has helped to create an ecosystem in India. And if for those of you following the news, Apple is trying to get almost all its smartphones manufactured in India, which will be targeted for the US markets. So what that is doing is that's also creating a ecosystem where these electronic components are also being built here. So all the things are adding up for an opportunity for India as far as flexible electronics is concerned. And what we see is a market, this is taken it from this particular source, all it gives is a very rosy picture as far as flexible electronics is concerned. Now coming back to IIT Kanpur. Now, in the year 2014, the National Center of Flexible Electronics was set up at IIT Kanpur and is sponsored by the it's a project sponsored by the Ministry of Electronics and Information Technology and a joint initiative along with IIT Kanpur. And the role of the center, National Center of Flexible Electronics, acronym is NCFlexi, is to form a bridge between the academic ecosystem and the industrial ecosystem. Now, in academia, there's a lot of research which happens, which unfortunately the conversion to industrial products is very low because of several reasons. And the role of the center is kind of form a bridge between them so as to enhance the conversion. So what happens, all the knowledge is generated that is taken up to a proof of concept level. One goes high in the technology readiness levels, which makes it easier for the industry to absorb it. And we have different modes in which we engage with the industry. The most preferable mode is a joint development mode, where we jointly come together to develop products. Another one is the technology licensing, that is whatever you have developed here in-house, that is licensed directly to the industry. And the third one is incubating companies. And this is the photograph of this, our center is a 6-storied building, 5,000 square meters, carpet area. And I would like to take this opportunity to invite all of you to visit our center if you are visiting India and especially if you're visiting Kanpur. It'll be our pleasure to host you. And this is a snapshot of some of the facilities what we have here. And what I would like to say is that we have equipment from lab scale to the industry scale. Now, one of the challenges which happens of technology development in academia is that most of them are done in a lab scale, and scaling them up to the industry scale has challenges. And as they say, there's many a slip between the cup and the lip. And that also does not give as much confidence to the industry people. Here, what we have done is by putting industry scale, at least semi-final scale facilities, all under one roof, we give the confidence to the industry that all these things can be done here. And they need not focus on, or they did not invest in early scale for early scale development activities at their own places. Rather, they can use this as a shared facility. So this is something which we pitch to the industry, and that is something where we have got a lot of traction. Now, this center has participating faculty members. All faculty members of IIT Kanpur, they belong to academic departments. Hence, there are no specific faculty members who are full-time into the center. But here, the center has several faculty members who are from parent departments, and I am from Department of Chemical Engineering, and also affiliated with this particular center. In addition to that, we also have full-time research engineers, and also we have a full-time chief operating officer, who are the core members of the center. In addition to that, we also have adjunct members. And also there are about 60 staff members, and these are the people who run it. And for more information, I request you to look at this, our website, www.ncflexi.in. These are some of the work which happens in our center: thin film transistors, organic light emitting diodes, photovoltaics, inks, batteries, and sensors. And I work in the area of sensors, and my subsequent presentations will give a more snapshot of what we do as far as sensors are concerned. So as far as sensors at the National Center of Flexible Electronics, there are different types of sensors we work on. Gas sensors, I'm just giving a snapshot of some of our publications in this area. And all these things are on flexible and printable substrates. And what is the advantage of having these on the flexible printable substrate? And also we use primarily organic electronic materials. Is that all these things can operate at room temperature. Now, compared to the conventional gas sensors, which are typical metal oxide sensors, which need an operating temperature about 200 degrees Celsius, we can have these at room temperature sensing. Many applications, for example, apart from wearables, for example, can you put the sensor patches on the shirts? And as people go along, especially for in mining area, for mining and all, where perhaps there could be some toxic gases, can that be sensed? Also, we are also working, and especially if for those who are in the medical field, can we use breathalyzers? That is something which you're working on. You breathe into it, and then from the breath, can you find other markers? And at the same time, can it become an electronic nose? We are also working with some industry for making electronic noses. When food becomes bad, the gases are emitted. Can we find out what is the state of the spoilage of the food? This is something which we are working on. Immunosensors for different healthcare applications. And our focus has been trying to understand the reactions, trying to understand geometry. And now can we make wearables where we can have these different kind of sensors? Electrochemical sensors, different kind of electrochemical sensing. And for example, if we are also working on this sweat sensors, that from sweat can we come up with a different kind of, can we measure the analytes? At the same time, also we are also looking at selective field effect transistors. And this gives a snapshot of what we are working on here. And several of the technologies which have developed here have been licensed to the industry. For example, the system for food characterization. When food becomes spoiled, the gases which are emitted can also be a marker of the state of the spoilage. And these are the strips for electrochemical detection of total and direct bilirubin. So we have developed these strips, and the novelty includes the catalyst, where we can have a non-enzymatic reaction, where it can simultaneously detect both a direct and a total bilirubin, and use a 5 electrode system. And also we have developed the strips for detection of enterotoxin and Staphylococcus aureus. And also we have developed a watch and a smartwatch for the blind and the visually impaired. So having talked about flexible electronics, as far as what flexible electronics is and the opportunity for flexible electronics in India and what we are doing at IIT Kanpur. And next I'll come to wearables. And I've taken this from this particular figure, from this particular source here, which gives an evolution of the wearable sensor systems. And what it shows that, okay, that we have both, that activity started sometime in the early 60s. Perhaps the first wearable was the Holter monitor for cardiac monitoring. And throughout the years, several activities have happened, some of which have been commercialized. And this stops at 2021 and 2022. I'm sure a lot of things have happened in the last few years. And many more things we expect to happen in the next few years as well. Now, again, if you look at the top 5 wearable device companies, this is Apple, Huawei, Image Marketing. I apologize for the quality of the figures, because perhaps they didn't want that to be copied from the net. And hence, that's the reason why they made it easy. But this is what it is. And also, if you look at the worldwide wearables of forecast, this gives the numbers. If you look at the global market, it's about 70 to 120 billion US dollars. It depends on different market reports. And the compound annual growth rate is around somewhere within 14 to 19%. But all it gives is a very healthy picture as far as wearables are concerned. But what perhaps would be more interesting to the viewers here is where does India stand as far as the wearables market is concerned? And these are some of the main players, both Firebolt, Noise, and then Ivaco, and a few others. And these are the major players. But as we speak, there are several startups which also have come up in the wearable space. And we expect them to, at least some of them, to grow in the years to come. And coming back to what we have in the National Center of Flexible Electronics, this is, as I had mentioned earlier, this is one of the wearables which has already been licensed. And this is a watch and a smartwatch for the blind and the visually impaired. And what I've not mentioned here, that we have also got Indian patents and a US patent on this. And very soon we expect a market launch. I can talk about more details during the interaction session. And this is another wearable device which you're working with, is joint development with a company. And this is for screening breast cancer using thermal signals. And hopefully this also should get the startup expected to take this up, and something that should happen later this year. In addition to that, several of the sensors which I talked about, these are also getting into a prototype level. And here is an example of a wearable thermal sensor. And let me see if I'm able to, you can see the movie here. So these are the sensor, the materials which we have developed. And this gives much higher sensitivities compared to the metal sensors. The metal sensor typically give about 0.1%, which is TCR, and here we have got about around 3% TCR. Okay, I mean, this goes on to show, what, okay, that we are able to measure the values. Another one which has gone a little bit further are the wearable sweat sensors. This shows what that a patch which we have developed for efficient collection of the sweat. And once you have an efficient collection of the sweat, then we use electrochemical sensors in order to find some of the analytes. And here is one video which again shows how this works. So we have done on human tests, but this is what I'm showing it on the capabilities. See, what happens is that when you have a patch, we want to ensure that the sweat also flows against gravity and it's orientation independent. And this is what, again, we have demonstrated, and this is what we have used by utilizing materials and also designs. And we have learned a lot from nature. A lot of biomimetic approaches have been used to make these things.
Dr. Panda, sorry to interrupt, but with the interest of time, it would be great if you can. Oh, you are already summarizing, so that's great.
This is something from wearables told about it. Acknowledgement to all the students, all the colleagues, project staff members, funding agencies, and thank you for your time and attention.
Great. Thank you very much, Dr. Panda, for such an inspiring and insightful talk. So I'll just quickly address the audience to, if you have any questions, just feel free to write in the chat. We'll discuss it during the session, end of the session. So now, without further ado, we would like to invite our next speaker, Dr. Titas Mondal, who is an assistant professor in Rubber Technology Center at IIT Kharagpur. His research interests include elastomer composite-based flexible and wearable sensors and triboelectric nanogenerators. So, Dr. Mondal, the floor is all yours.
Thank you. I think I'm audible, right?
Yes.
Thank you, and thank you to the organizing team for giving me the opportunity to talk about this interesting topic of the wearable technologies, current progress, and prospects in India. But I'm a little shaky because, talking after Professor Panda from IIT Kanpur, it is more like Muhammad Sami coming for batting after Virat Kohli. So it's batting I'm talking about. So anyways, so I'm pretty new in this domain because I was working on a different domain. And if the organizer permit, may I share my slides which I have prepared for this particular? Yeah,
sure.
just a second. Just please let me know if my slides are visible.
Yes, perfect. But
Okay.
yeah, now.
Perfect, perfect. So thank you so much. Just a disclaimer, because the views, whatever I am presenting here, it's absolutely mine, and IIT Kharagpur doesn't endorses anything. This wearable technology is something which is very fascinating, and what you can see is, currently, if you sit in India and look into the different initiative which the government has taken, the government of India, which they have taken, is they have launched different missions like Ayushman Bharat Digital Mission, the national NDHM ecosystem they have come up with. Then there is Fit India movement. So this all movement, if you see, there is a huge part where is basically, the wearable comes into the play. And also, if you look, there are a lot of product linked incentive schemes which are set up by the government. And needless to say, there is Make in India, thing which is going on in our country, and also the Startup India. You get to see that a lot of new startups are coming up, and needless to say that there are a lot of companies which are also venturing into the wearable technology. And obviously, these are getting supported by funding agencies like MeetY, and also MeetY is supporting us as well. So what we can see here, there is a huge impetus, like, to make and integrate this digital health concept into the Indian mindset. So the only thing through which one can achieve such kind of thing is by betting on the wearable technology. So India has been doing pretty good in terms of this wearable technology, but if you look into the current report, I mean, there is something, there is a drop into the market. Like, I believe, I think Dr. Bhattacharya from Ultra Human is going to talk much about, maybe about the market perspective. So, but what I was just, when I was just researching these activities, what I saw this year, like, there is a dip into the wearable technology, despite there is a huge impetus given by the government in promoting this particular healthcare. So what could be, like, the reason for this? Like, basically people are, like, trying to understand what are the reason. Like, for instance, if you look into the smartwatch shipment does account to the sales part also. There is a minus 34.4% decrease compared to the sales volume that has been. So does it indicate that wearable is something which is now declining in India? In my opinion, and also in the opinion of some of the experts in this domain, what it has been identified that the products that are coming into the market, or the technologies that are coming into the market, are kind of undifferentiated product. They are not bringing in any additional benefit or additional attributes actually. So that's the reason there is a kind of a decrease into the market condition. But I mean, I don't know how many of you have observed during this Cricket World Cup, Virat Kohli was wearing a smart band, as you can see in his hand actually. So let me just switch on the pointer. If you can see, he's wearing a smart band here. This is, like, I'm not endorsing any particular brand, but this is something, a new class of wearable material which most of the athletes are preferentially looking after. The reason for this, like, the market analytics, if you look, there are a few things came up into this, is basically, like, this is bringing in certain differentiation effect into the product development. For instance, it doesn't have any display. And display sometimes, especially for us, it is fun. I mean, for fun, it is okay. We can just see what is, although I'm not wearing anything, I'm wearing a traditional, hand watch. But, some cases it vibrates, it can cause a distraction to the person who is basically wearing this. So typically, if you look into the US based basketball players, top notch basketball players, to our Virat Kohli, everybody is, using this type of band, which is not having such displays. But at the same time, additional thing which it can pick up is basically a very important physiological parameter, starting from your heart rate variability to other parameters, how much strain is there in your body. this particular bands are capable of picking up, and they made typically interface. And that's the reason, if you look into the company's profile, this particular company is something which is, the growth is happening pretty nicely. Now, what does that indicate? If you look like, into this particular, aspect, it is basically there is a need for strategic innovation. Like, we need to channelize the wearable technologies into the domains where, you can get this type of specific, targeted things and more precise, output you can get from. So in other words, if I say, you need to have better sensitivity of this, using this wearable devices. And I mean, how to chalk out those things. I used to work in an MNC as a scientist for quite a long time before joining the academic. So I used to love this particular image, which you can see. There is a thing called desirability, viability, and feasibility. My boss in my previous organization used to talk about, like, you should not run for everything, but in wearable, time has come that you should focus on the big bets, and those big bets can be typically identified. Like, you need to figure out this sweet spot of innovation, which is like the need of the hour. And how is this possible? This is typically possible through an interdisciplinary research. Like, when I talk about the wearable is a kind of a subject where it needs input of chemists, material scientists, physicists, electronic people, people from the computer background, AI, ML, and whatnot, basically. So you need to bring in people from domain expertise having background like this. So, and proper integration, I believe if somebody online is from this background, they can connect the dots and think about, like, what and how they can contribute towards the growth of wearable technologies in India. Now, this is what I thought of, based on the discussion with Swarnalok. I thought, just to give a perspective about what is happening in India. Now, a bit of my journey into this, nice domain. I would like to show you a very, a kind of a snapshot. Is something like, I started first working on the polymeric material in 2010 when I was a master student at IIT Kharagpur. And then what happened is that my professor moved as a director of IIT Patna. So there was no other option. So I had to also travel along with him to IIT Patna. Then this in IIT Patna, what I did is that I started working on the carbon nanomaterial. So he gave me three different problem statement and said, like, whichever you are comfortable, you take this one. But in my opinion, the second problem, which was on the graphenes, whatever he gave, is something like, very tough. You should think twice before doing that, because Nobel Prize for graphene was just awarded in 2010. So I said, no, I prefer tough things. So let me go ahead with the graphene. And that's how my journey in 2011 started, with the carbon nanomaterial. And then when I moved to the University of Houston, what happened is that I thought of integrating these two, like, technologies together, like, the graphene and the polymer together, and creating a polymer nanocomposite. And I used to do a lot of physics. I used to visit NIST and do the scattering experiment and all those things. And then what happened, I also came back to India due to a lot of reason, and I started working in an industry. There also, I commercialized a few products which are already there in the market, where based, I cannot talk much on those confidential things, and which are currently in the market. So it was again the polymer nanocomposite, or the composite journey began in that way. And when I joined in 2020, I'm kind of a COVID batch assistant professor, actually. The institute got shut down and I had nothing to do. But I still kept on dreaming, okay, I'll try to do something which I have not done earlier. So what I did is something, extended the concept of the polymer nanocomposite to this wearable devices. Because what I started to think is that, what I started to read is basically, one professor who highly influenced me is Professor Zenan Bao. I used to like listen to her webinars, lectures, and what beauty like she created, like stretchable electronics and all those kind of things. With that thought, I thought that, this carbon nanomaterials are also electrically conductive. And when I'm putting into the polymer matrix, they do have a tendency of forming a network structure, which is called the electrically percolative network structure. And if you look into the basic physics, actually, for any stretchable, strain sensors or temperature sensor, these are based out on the particular, electric resistive nature. And that's how my journey began on the wearable technology in my small room, in my small lab in IIT Kharagpur. Then we were doing pretty good in terms of the particular wearable technology, and we were making different types of sensor. As you can see, some of our older publications are listed out here. Anybody interested can just feel free to go through it and browse through it. So we were doing pretty good in terms of the research. We developed certain prototypes; those were highly appreciated. We are working with some of the companies for the technology transfer. But later, what we realized is that to have a good form factor, like when I talk about a stretchable or a wearable electronics, mostly the stretchable electronics, the pain point could be in those technology is the need for a battery to make that material workable. So how about self-powered techniques? So very recently, like 2 years before or 2.5 years before, what we started doing is making self-powered wearable technologies or self-powered flexible electronic materials for detection of several human physiological parameters. Okay, so that is what we have been doing in my lab in IIT Kharagpur. So today I thought I'm not going to talk anything about the science and technology, what we do, okay, because those are freely available in the internet. But while we do that, what we also think is that, some of the key challenges that, kind of exist in this particular technology. This is again my perception. I might be wrong. I'm a very new player in this domain, but scalability could be an issue because I worked in an industry, I did scalable technology and commercialize the material. But if I want to translate this wearable technology, whatever we are doing here, that might be a bit challenging. Then we need to think about the durability of the material. Should we focus on a one-time use sensor, or should we focus on something which has to be used for 1,000 cycle? Now, integration of the electronics to that, like making it more IoT enabled, is something which is again a pain point at some of the cases. And another pain point is that, like for traditional sensors, we have a very straight cut protocol for standardizing the material. Okay, I mean, standardization, we need to do the calibrations. But here, sometimes if it does demonstrate a non-linearity, multi-point calibration becomes a little bit difficult. And there are many such key challenges which are existing in this. And one of the point number 8, as you can see, if we can make this self-powered IoT devices by harvesting the body motion or anything similar to that, that would be really nice. And I mean, this is something a non-negotiable fact. If we want to see our technology into the market, we need to have a strong global collaboration with the different companies and the academia and cross-institute research. So with that, since Shwanalok mentioned, I just have 10 minutes of time. I need to wrap up, and I would like to thank again Professor Asim and all the organizer for giving me this opportunity to talk. Thank you so much.
Thank you, Dr. Mondal. It was a great talk, and I really enjoyed the fact that you actually um, came from a different domain, being as a material scientist or a polymer scientist. I am also a polymer scientist, but I work more mainly in the drug delivery domain. But it's great to see,
Right.
and also how you emphasize the need of interdisciplinary research. So really
Right.
enjoyed the conversation. So now, with further ado,
Thank you
I
so much.
of course, thank you. Now, with further ado, I'd like to invite our next speaker, Dr. Vinu Mohan. He is an assistant professor in the School of Engineering at Trinity University, Manipal. His research interests include the development of wearable microfluidic patch for multiplexed non-invasive monitoring of biomarkers from sweat samples, smart diapers, sensors, and epidermal biofuel cells. Dr. Mohan, please take it away.
Good evening, one and all present here. Actually, myself, Dr. A. Binu Mohan, currently working as assistant professor. So, am I audible? So, currently working as assistant professor at Srinidhi University, Hyderabad. It's a private deemed university. It's a very new university. So basically, I did my PhD from NIT Trichy, National Institute of Technology, Tiruchirappalli. I started my journey from 2010 and 2014 I completed my PhD in the field of electrochemical biosensors. So and during my PhD, I used several modified electrodes and we prepared electrochemical sensors for glucose, nitric oxide, L-tryptophan, and molecularly imprinted sensors for dopamine. So that was my work. And we used conventional electrodes like a classic carbon electrodes and platinum working electrodes. So it's more kind of academic point of view work. And after that, I got an opportunity to do my postdoctoral research under Dr. Joseph Wang, University of California, San Diego campus. So, Dr. Joseph Wang, one of the very pioneer in this area of electrochemical biosensor, especially in the field of sweat monitoring. So, the wearable sensors that we can microfluidic patch kind of sensors that we can directly attach on top of the epidermis, and we can have a real-time monitoring of biomarkers. So 2 years I worked there in University of California, and then I got DST Inspire Faculty Fellowship, and it's one of the prestigious fellowship or prestigious award from the Government of India. So, 2017 to 2022, I worked as a research inspired faculty at CSIR Institute, Central Electrochemical Research Institute, which is in Karekudi, CSIR, CCRI. Then, from after completion of inspired faculty scheme, I worked for 2 years as a research scientist. The funding coming from SERB. Then recently I moved to this private university in Hyderabad, Srinidhi University. So I would like to share after coming back to India. So what work I did in the field of wearable electrochemical sensors. So let me share my presentation. So can you see the slides? My slides are visible.
Yes.
Yes, yes, sir.
So first, I would like to give an introduction about what are the advantages of wearable biosensors. All we know what are the advantages, but I would like to pinpoint some of the things. So all we know the tedious blood sampling procedures involving in either a glucose analysis or any other the gold standard blood analysis. So whenever we are suffering with any disease, definitely we will go to the hospital and we have to do the blood analysis, and we will see what are the levels of the biomarkers. But if we want to do this for multiple times, for example, for diabetes monitoring, we have to monitor the glucose level before the meal and after finishing the meal, and sometimes morning and evening we have to do. So especially some babies they are born with type 1 diabetes, and especially for older people, elderly peoples, the frequent blood analysis is very challenging. So if we have some alternative biosensors, some wearable biosensors that we can attach directly on the human skin, and we can exploit other non-invasive biofluids like sweat, saliva, interstitial fluid, and tear fluid. So, majority of my work focused on sweat and saliva. And during my postdoc, I worked on microneedle-based biosensors to track alcohol levels directly from the interstitial fluid. So I would like to highlight what are the challenges. So the conventional sensors, when we are transitioning into the wearable or like a flexible sensors for wearable application, what are the challenges? The first thing is coming from its complexity. For example, initially I said during my PhD I worked on platinum based electrodes or glassy carbon based electrodes. And when we are moving to the printed electronics, what are the challenges? Especially to prepare conductive tracks, what are the challenges? So, and suppose if you are preparing some flexible sensors and if you are directly attaching on the human skin, so there is a problem of poor assembly. And our skin surface is not very clean. So, whenever we are attaching our biosensors, there is a possibility of biofouling. uh, some of the dust or other toxic contaminants can foul out the electrochemical sensor surface. So my aim is to how we can avoid such problems. And another one problem is coming from the its mechanical resiliency. So mechanical resiliency in the sense, so if you are looking into the commonly available point of care testing of glucose sensors. So they are flexible, but not very. The flexibility is limited to some extent. So if we are preparing some stretchable sensor, so all we know, our human skin is not only flexible, it is stretchable also. So if we are stretching, we can stretch maximum to a limit of 30 percentage. Just imagine some sensor we are developing and we are attaching on the human skin. But whenever we are doing some fitness activities, some exercise activity, if it is breaking, then the performance will be gone. Then we cannot do the real-time analysis. So, in order to for the sustainable systems, definitely we have to improve its flexibility by making more stretchable system. So, my recent research work is focused on developing microfluidic systems to enhance its fluid sampling. For example, if you are thinking about sweat analysis, different people's sweat different ways. For example, male or female, with respect to gender also, there is sweat rate change, and depends on the climate change, or depends upon the emotion. The sweat rate is very different. So if you are preparing some microfluidic channels and attaching on the electrochemical sensors, then we can improve our sweat fluid sampling rate, and we can have a more precise analysis of multiple biomarkers parallel. That means from a few microliter of the sweat, we can have multiple some 4 or 5 biomarkers we can analyze. So I will showcase one of the work. So this is a multiplexed electrochemical sensor that we developed in our lab in CCR Sikri. So here this is a flexible microfluidic sensor. So the challenge here is how we can have the multiplex monitoring, and for the microfluidic system development, how we can do. So all we know, if we are developing an electrochemical sensor or some wearable sensor, we have to reduce the its cost of manufacturing. So how to do? So all we know, for preparing microfluidic channels, definitely majority of the people are using lithographic techniques. But here we try to avoid those tedious processes, and here we prepared some printed array of electrodes, and that means some printed tracks we prepared, and we developed our microfluidic channels using those masters. So the good thing is, using if we are using lithographic techniques, we can use maximum 1 or 2 times. But here using this printed tracks, if we are using as a master, we can reuse those masters, and for multiple times we can prepare these microfluidic channels. So the figure shows completely integrated microfluidic system. So this is a prototype device that we developed, and we can have a real-time flow of sweat from the inlet to all the outlets. And here we developed the sensors for monitoring lactate, sodium, potassium, and pH. So, in order to have a real-time analysis, definitely we have to use some portable potentiostat. So here our challenge is how to monitor ions, like we are using ion selective electrodes for monitoring sodium, potassium, and pH, and other enzyme based electrodes like amperometric sensors for lactate monitoring. So how to do the parallel monitoring? So for that purpose we prepared a typical circuit, so where the amperometric circuit is grounded, but on the potentiometric, the three sensors are based on potentiometric circuit. They are like in a floating manner. So we didn't observe any interference problem during this parallel measurement. So continuously we could able to monitor these four biomarkers. And then we moved into the developing a stretchable microfluidic sensors. I previously I said what is the benefit of having a stretchable microfluidic sensor. So even though if we are doing like exercise activities, even though our skin is stretching maximum to a limit of 30 or 40 percentage, we can continuously monitor. There is no problem of sensor breakage or any interference from the resistance change. So here prepared carbon-based nano composites, and we printed using screen printed techniques. We developed multiplex electrodes on a PDMS platform, and you can see the microfluidic channels. So the inlet of the microfluidic channel is at the center, and three outlets are at the uh, uh, opposite region. So so it can easily come in. So it can be easily entered into the sensor region, and it can pass out of the outlets.
Dr. Mohan, just
Yeah,
sorry to interrupt. Just to
yeah,
be like in interest of time, you have
yeah,
2 minutes.
yeah, sure, sure. So another one sensor, this one we developed like a neckband based biosensor we developed. So the advantage is this is a microfluidic sensor. So similar to wearing a headset, we can wear, and directly we can have glucose monitoring from the sweat sample. And this is one portable VOCT device we developed, especially for the saliva monitoring application. So currently we are developing microfluidic sensor. We are integrating on top of the 3D printed mouth guard so that we can have a real-time analysis. But so far we succeeded in developing POCT device. It's like a handheld meter. We can directly collect saliva samples and do the analysis. So we could able to monitor glucose, lactate, cholesterol, and uric acid directly from the saliva. So these are some of the ongoing work. So we are developing diaper-based smart sensors, especially for urine analysis. So these are the printed sensor on top of the diaper, and we are trying to monitor glucose level, glucose level and uric acid level directly from the urine samples. So another work I'm exploring to develop enzymatic biofuel cells. So as a self-powered sensor, usually I'm using amperometric sensor, but we have to apply some particular potential for the sensing event. But if you are using biofuel cells, you don't need to apply potential. Whenever the electrodes are coming in contact with sweat, it produces some electrical current, so that current response will be proportional to the concentration of the biomarkers. So based on that working principle, we are developing currently self-powered biosensors. So that's all. I would like to reveal more details during the discussion. Thank you, and thank you for giving this wonderful opportunity.
Wonderful. Thank you, Dr. Vinu Mohan, for such a insightful talk. We are definitely looking forward to interact during the Q&A session. And I would again remind the audience to just keep on posting their questions in the chat. So now we would like to introduce our final speaker, Dr. Aditi Bhattacharya, Vice President of Science, Ultrahuman, a renowned wearable technology company with multiple products in the market. Dr. Bhattacharya brings decades of experience in R&D at government and private sectors and an expert in product R&D, clinical and research partnership, scientific strategy, leadership development. Welcome, Dr. Bhattacharya. The floor is yours.
Thank you so much. And it's wonderful to be here. I have intermittently worked or interacted with people of Sai ROI. And it's very nice to see the evolution of this and how, mission driven it has become over the years. So kudos to everyone who has been a part of the volunteers committee as well as the organization visionary committee on this. And I hope that this is not just going to be one interaction and there might be many more to follow. So thank you for that introduction because I was planning to do that right at the end. One of the things of being a woman speaker amongst a male panel and then being the industry speaker amongst the academia is that you get to do a lot of things which are different. And my talk is going to be short. It's going to be simple because what I want to do is essentially incubate ideas, explain how the other side is, and then how the science can actually reach those things. So what I'm going to do now is I'm going to share my screen. And please let me know. I'm going to go into screen share mode. So as a result, let me know if anything
Yes,
is not.
we can see it.
Oh, wonderful. So the first thing that I wanted to say is we always talk about science in context of curing a disease or addressing disease. However, one of the very latest WHO reports have said that essentially most of the people in most of the countries across the world are going to die because of chronic illnesses like diabetes, like heart failure, like certain other things of that. So all the green that you're able to see are essentially those. And that's something which happens to be a real challenge and a real problem that everyone in commercial place is talking about. Prevent diabetes, do this kind of regime, do that kind of regime, etc. and all that. The problem is most people are talking about fixing it after the problem has presented itself. So you're trying to essentially push the camel out of your tent once it's inside. We are talking about health maintenance, health optimization, and wellness. And the problem is, it's very, very hard to truly quantify who is healthy because every one of us has some kind of something. But what we can do is essentially figure out what is called as health span. And this is a concept which has been gaining a lot of currency in the past 10, 15 years, which is essentially the longevity catchword, but also health span, which means essentially how long in your life can you be as active as you can in your peak performance, physically, mentally, without requiring medication. So we are very good at fixing a broken system. But how do you make the system remain so that it doesn't require to be fixed? It's a very, very simple concept. And one of the reasons that health span gets affected is, of course, we go through gallons of stress, buckets of stress all the time. We do have foundational trigger factors, but those are a very small amount. And then you require directed regeneration, recovery, etc. And then, of course, the environment. Anybody who's staying in Delhi during Diwali knows how much that is going to impact your, wellness long term. So I'm being extremely simple here. At any given point, I can actually dive in during our discussions into some of the more metrics and the scientific publications, which support that. But I think these are pretty much things that we all end up agreeing to. Now, health span management requires, of course, knowing your foundational genetics, your life history, etc. But it also requires a continuous data stream that provides you, along with frequent health assessments, when you are well, to actually look at how your body is doing, how the trajectory is going, and what can be the actionable levers that you could pull in order to go past this. Now, the problem with that is a lot of this has now started becoming an N of one kind of thing. You have influencers who end up experimenting on themselves, and then they say, this is something that actually worked for me, and this is something that is amazing. And everybody ends up thinking about doing the same thing. This works, great. N is equal to 1 in rare disease research is very important because you just have one sometimes. But in this case, it isn't true. The only problem that happens here is that it's not contextualized. So while that might work for Virat Kohli, it may not work for you, right? So it's important for you to know what works for you. And this is something that requires precision, continuous historical mapping of your health data, and to provide integrative insights into that. And that's where the entire field of healthcare wearables and consumer-based technologies is essentially going. And yes, we do come up with Whoops and the Apple Watches, etc., of the world fairly often. And that's something that you will figure out at the time that I present more about ultrahuman. But the other thing that's happening, and a trend that's been happening is, and started mostly by COVID, is wellness and healthcare are converging. Because everyone understands now how powerful a remote-based, decentralized surveillance system or an action plan can be. These are also something that have financial motivations in the developed countries. For us, it's quite often about just access to holistic, integrative healthcare in India. So this is a market space. The problem sometimes is that you get more US data than Indian data. So I'm essentially citing a lot of US data here, but it basically gives you a trend. And with our changing demographics, we have a substantial portion which is going to age. We have a substantial portion of the demographic which is going to move in to the 30s and the 40s when the first signs of these actually start coming up. And that is the place where the preventive bit should actually come through. So that's the place where most of the wearable companies, most of the wearable innovation, which is consumer focused and consumer driven, is looking at and doubling down on. So what's the difference here and how does this actually work out? And this is something that I mostly have to explain to people who come from a medical background, but just walk with me through the same slide. So you have a person who's nominally healthy, and there's a person who probably has a disease, a chronic disease, which actually requires management. You have a third person who's probably at the cusp, which is called as a risk, right? It is possible to pivot either ways. You can pivot one way towards health in case if you're able to intervene faster and you're able to figure out what are the triggers and provide and get a certain kind of holistic input and probably a team that works with you. It could be friends, it could be a doctor who actually understands more than giving you pills. And then there are people who are basically trying to stop going from risk into disease. We are using the same biomarker readouts. That's the funny thing. So heart rate variability is something that gets peddled by every kind of wearable that is there. Any kind of wearable is going to give you heart rate, it's going to give you movement, it's going to give you heart rate variability. Now the Whoops of the world end up looking at fitness, sports, longevity, because that is the place where they want to focus on. And that is something that they are extremely good at. So training load, recovery, endurance, these are important things for people who are doing this as professionals, as serious amateurs, etc. We also have a very significant population like this who would like to continue like this. Also have another set who are using the same heart rate variability, but they have arrhythmias. They are probably looking at a genetic risk of heart failure. They are trying to find early signs of the disease coming up or triggers to it. And hence it becomes important in prognosis, treatment outcome, and care management. So like I said, they are both coming into the same biomarker output. It's what you do with it. And then the wearables are able to provide you not just, so the medical devices for the arrhythmias and the heart failures and all that are just going to give you that. The wearable device will be able to give you, well, your heart rate increased, like my ring kind of just gave a notification that your heart rate increased in spite of the fact that you're not moving. So what is happening? Well, I am waiting in the lines to give a talk. So that kind of contextualization of information becomes important for the person. And that actually comes back to Dr. Titash's thing that why is it that wearables are not able to ship as much or there is a demand less for it? Because you cannot give diffuse insights. You have to give insights which make sense for the person. And that's where the value comes from. And The wearables are now going to start to inform the medical devices sometimes about the risk prevention, etc. Our ring is one of the first which has a arrhythmia detection during sleep. And the medical devices, which are very good and they work extremely well, and most importantly, in acute intensive hospital scenarios, will not be able to provide the same kind of continuous reading and lightweight, passive kind of optimization of data in a real world scenario. So you will not be able to wear a Holter monitor for more than 24 hours, but you will be able to wear a 2.5 grams ring, which has a battery life of more than 4 days, and just let it go. And it is gathering the data. And that's something which is the idea that we have to go into. We have a lot of lovely ideas which are there in terms of accuracy, in terms of fitness. I saw some of the things with the sensors which were shown here. They're wonderful. But is it possible for the sensor to actually work for an ultra marathoner who is running 100 kilometers, Rajasthan marathon, and looking at their stress and hydration level? We are talking sometimes at that level of real world evidence, because it's not just the sensor, it's not just the durability, it's also the way in which it talks with the application. Is it able to work, or does it have a memory which allows 8 hours, 16 hours of data to actually get in and store there, which can be then ported into an internet client? These are the kinds of multidisciplinary questions and challenges that academia and industry together can actually work towards. So with that, I'd like to talk about Ultrahuman. And Ultrahuman is a 6-year-old company. It is headquartered in Bangalore. We do most of our R&D there. And by that, we mean that we do our manufacturing, we do our software development, as well as our feature development all here. We do have offices and presence across the world. We are amongst the top smart rings in the world. And it makes me very proud to say we are one of the few consumer electronics that actually ships from India, innovated in India, across the world. And it just not doesn't start with that. We also have a slew of other things which are happening. We have a lot of research that happens, which actually comes out in terms of patents and trademarks. And we have publications also, which are getting published and in the pipeline. So there is a fair bit of multi-diverse environment, and that's something that we end up doing. We have not just one product, we have a constellation of products. Some of them are things that we have licensed, and some of them we have made ourselves. So the Ring Air is the world's lightest wearable ring. The home environment, the Ultrahuman home, is actually something that connects together with the ring, and it looks at the environment in which you spend a lot of time, which might be during sleep, in the gym, in your office, in your labs, etc. We have clinical dashboards. And we actually started with the CGM, which is licensed from Abbott, but we have a clinically validated metabolic score, which is important for people with normal glucose control, as well as for ones at risk. These are things that we have in terms of our device ecosystem. And we also have, like in an app store, you can go and look at your special needs. So we have something called as power plugs. A lot of them are clinically validated, FDA approved, etc. And in case if you need to activate any one of them, you can actually do that. So this is the ecosystem. And why are we doing the ecosystem play? Because the ecosystem play helps us in integrating and contextualizing information, which can be provided in terms of context. So if I want to think about the ring giving me heart rate, sleep stages, the temperature might be giving me some stuff about thermoregulation, hot flashes in case if you're a slightly older woman, and looking at your energy expenditure. The air quality of your home is something which can also be triggering a lot of those. And that's something that one doesn't end up thinking about when you think about the output well-being. Similarly, snore detection or noise is something that can impact your sleep. You may be having early signs of sleep apnea, and which is something which will come up because if your respiratory rate but also something that also comes up because of the noise. And of course, the continuous data stream is something that can merge extremely well with the glucose variability monitor from the CGM, as well as blood vision, which are essentially blood-based biomarkers, which can tell you whether your cortisol levels or your HSCRP levels are through the roof. And that might be because the AQI in your bedroom happens to be really high, and you have a lot of IgE as well. So you need a multidimensional way in order to make the insights usable, understandable, and actionable for the user. A small science plugin, one of the things that we also have, because we have more than 600 million CGM data points, is we have an open source CGM response database. This is absolutely free to the public, and that's something that people can end up utilizing. It was one of the things that we did. I quickly threw in this slide because of Dr. Titash saying about the contextualization. The contextualization becomes very important. So we have something called as a stress rhythm score. The point is, most of the studies, etc., which are done are either controlled studies. These are not real world messy studies, and they are not done across the world. Now, we can actually end up doing that because we have over 50,000 active users within a month, and we have lots and lots of data from them. So one of the things that we did is essentially look at the stress rhythm scores of everybody else. Now, you can have a stress rhythm score that's high. That means that you're pretty chill, you're pretty relaxed, and you've been able to tag this very well with your circadian rhythm. If you are like me right now, who is in the evening trying to give a talk and your heart rate is going up, then your stress is slightly high, but it might be also that I'm happy and all that. Now, one of the things that you find here, which is this bar here, you find that as compared to the global average, India seemed to have a concomitantly less amount of good stress. And that's because of the circadian misalignment that kind of happens. A lot of the people that we have as user bases are techies. They take these late night calls. They sometimes have night shifts and all that. And these are the kind of actionable insights that we should be able to give them. So these are the kind of studies that we also do, which informs our product, which then informs features, which also informs the kind of nudges and notifications that we do. So if you think about this in terms of the East versus West of the world, you will find that the circadian misalignment is far more in the East, as you know, compared to the West. And these are all things that are freely available. We publish these rather than going in for actual peer-reviewed publications, because sometimes it's better to send this out to the human beings who are actually our users. So if I have to think about what kind of a biologist fits in to our kind of company, we essentially are looking at a multi-hatter or a multi-bagger. We are actively recruiting, but we are looking for people who are very strong in analytics, because we need people who will be able to analyze a plethora of different things. So we are looking for people, and let this be some of the filtering criteria for it. We are looking for somebody with creative drive, look at a problem, look at a trend, and help us figure out if there is more insight that we can deliver to the users. We are very customer obsessed. Communications, being able to explain a complex thing to a layman is very, very important for us. If you're able to mess around with hardware, foldable sensors, curved stuff, we are, extremely happy with that. But the biggest thing that we have to do is speed and precision, because we have to ship fast, we have to work hard, and we have to always end up working with the most biggest giants in this wearable field. And the healthcare place is becoming very, very competitive and very, very innovative. So if you want to connect with me, these are my email IDs, and you can just drop an email and see if there are any places that we can align on. But this is something that a lot of people end up asking me, because I've worn many hats. How did this journey actually happen? So the top row is essentially looking at me doing my BSc in biochemistry. After that, I did my integrated PhD in NCBS. Then I went and did my postdoc at CNS NYU. And then I came back as an independent researcher to INSTEM. This was a funnel of increasing depth and specialization. Then I pivoted and I moved into, industry, where I worked with 11 of the top 20 pharma with Cactus Life Sciences. I worked as consultants to a whole bunch of AI and different VCs, etc. And then I moved into ultrahuman. And so I became more of a generalist. So the wearables thing, as someone said, we literally need more generalists. We need people who are ready to think, who are ready to work across different groups. And that's something, if you're ready to look at, there is literally a whole unexplored panoramic vista out there. And it just doesn't have to be with Ultrahuman, it could be with any kind of a group, but do that at some point. And don't be scared to learn new skills and recreate. With that, I'd like to end. Thank you very much for the opportunity. And I'm guessing we are going to have a lot of questions.
Thank you, Dr. Bhattacharya. It was very nice presentation, and I think this is one of the proud moment for all of us to see how Ultrahuman being an Make in India company and how it's leading a lot of the products which are well competitive and some cases they're leading along the world. So great to see that. So I will quickly share my slides. So this is time for a poll. We will take a quick poll um, with the participants. So I will initiate the poll. You should see on your screen, and you will quickly answer. I will keep it for maybe 20 to 30 seconds, just for the interest of time. We have just two questions, so right now it's the first question. Okay. It's great. Should be able to see the results. So we have around 60% who has already subscribed to our YouTube channel. I would request for those 40% who has not subscribed but joined this webinar. So welcome, and please subscribe to the SciROI YouTube channel where we share all of our different kind of activities as we mentioned in the before. I'll stop and share the start the next poll, which is the last question. So it looks like we have a good split of different background, chemistry, biology, physics, engineering, not many math here, but great to see. I think I will pass it to Sornolok now. He will start the Q&A session.
Okay, wonderful. So those who haven't subscribed, we encourage you to subscribe to our YouTube channel to stay in tune with our future activities. So now we'll like to start our panel discussion and Q&A session. So for that, I will like to remind you again of the Zoom etiquette. So please keep yourself muted throughout the webinar. Please post your questions with your introduction in the Zoom chat, and we'll try to accommodate as many questions as possible. And also, for better interaction, we request you to keep your video on. Okay, so first of all, we take the questions from the chat. So first question is from Sudeshna, and she has asked Dr. Panda that how much does the thermal sensors for breast cancer screening cost, and at what stage it can detect cancer?
Right now, we are sourcing the sensors from a commercial entity, and the cost depends on the scale. So it can vary from 30 rupees to 15 rupees depending on the amount of, the numbers we buy. So as far as what stage it can detect, see, it is we do not call it a detecting device, we call it only a screening device. And what we plan to do next are the validations, the clinical validations, and at that point of time, we'll have a better understanding as to at what stage it can screen out.
Thank you, Dr. Panda, for the response. I think we also collected some questions before the webinar. I would like to give the chance to all the panelists to answer that. So, in recent years, we have seen the rise of several multidisciplinary initiatives in India, like HTIC, NCFlex, Swastha. I think I knew I focused on wearable healthcare technologies. So, how are these shaping the research ecosystem in this field, and what do you see as India's long-term vision for wearable healthcare sensors? So whoever want to take it and start.
Okay, let me take the first stab at it. So what I understand from the question is that, like, what are the recent initiatives?
Mainly about multidisciplinary initiatives India has
Yeah.
taken, and how you see India's long-term vision for healthcare, wearable healthcare sensors. So I think these are government initiatives. Some of these, the Swastha, HTIC, NC, Flexi.
Also,
Okay.
I would like to add to Dr. Pandal, since you are associated with NC that like for us who are planning to return to India, so does this kind of ecosystem also provide us with some collaboration or funding opportunities while moving? Because some of us kind of plan to apply for Ramalingam or Ramanujan facilities. So can you host us like this kind of information which will help the people from abroad to shift in this
So
field?
let me take the questions in the random order. Yes, we actively look for people to be associated. In fact, people who want to apply to IIT Kanpur. If you want to apply for a faculty position, and as I mentioned, this center is not an academic center, it's a research center. So those who want to apply for academic positions, we all come to departments. Like I come from the Department of Chemical Engineering. So actively encourage people to apply for faculty positions at IIT Kanpur. And if you can put in that, okay, you have a special interest in flexible electronics, and at some point of time, just send me a mail. It is, I'll try to see, what, because we are also looking for people, and that also would help. And then coming to the other question as to how these multidisciplinary centers have come up, I cannot speak for what is happening in the rest of India, but I certainly can speak of what's happening at NC Flexi. This is indeed an interdisciplinary center because, as has been mentioned during some of these talks, some of the presentation, I mean, today we are no longer we can work in silos. I think there's a need for strong interdisciplinarity. And very specifically, if you look at what we're having, in the field of flexible electronics is very interdisciplinary. You need people from different engineering backgrounds, from science backgrounds, from mathematical backgrounds, and also we need people with business capabilities, because at the end of the day, all these things have to come together. So when we make a pitch, in fact, like when we pitch for when we pitch for these kind of projects to the government agencies, they look for these kind of capabilities, like what is the profile of the members of the team who are presenting. So all these things are indeed there, and there is a big push for interdisciplinary, because that's what is the need of the hour. And NC Flexi indeed is a very interdisciplinary center.
Anyone else would like to comment on the interdisciplinary aspect of or how India is actually taking some of the steps?
Right. I just had to share something that Ultrahuman in the past several months has been involved in a couple of international interdisciplinary grant conversations. And there are different things, as Dr. Panda said, that different people bring to the table. And it's very important to see what the team can bring in. And I think one of the things that we learned while helping review the grant or support the grant or something like that is what skill sets or what insights we can bring in. Sometimes that go-to-market strategy, what is going to be more important, may seem very incremental when you're sitting in a lab, but it may actually have a very huge spin-off effect And those are the kinds of things that we can bring in. We can also bring in real world challenge kind of things, like this may look very well in this place, but if it's so heavy, it'll probably not work. So I think it's very important for whoever the partners are to start having the conversations well in advance so that there is enough time for ideation. And then if you go with a consolidated project, then it mostly has a very good chance of winning.
Thank you. If anyone else want to add?
I think it has been very well explained by Professor Panda and Dr. Bhattacharya, but I would like to also put an emphasis on the mindset of the researchers who are still in the ambitioning to come to the faculty position or permanent position in these academic institutes. The mindset, what in my opinion, what the government is typically looking for is more product oriented kind of output. So there should be a tangible, outcome. Like it should not be only in terms of publishing good papers in high impact papers. So either you need to create a kind of a product, and by partnering with an appropriate company, and then bring it, because there should be, like, ROI stands for return of investment in your thing. So the government, whatever they are spending, they want an ROI, against that. And that should be, in my opinion, also the case, because we are not doing any charity. Money is coming from the taxpayers' money, so we need to be accountable. Like whatever we are developing, that should land up. So there is a strong need in the change in the mindset also for the people needed when they come to the academics for either through faculty position or any DBT fellowship or anything like that. So they should keep this thing in mind, that India has changed a lot. Now any project proposal you are submitting, first thing they're looking for, like, do you have an industry partner? And if you have an industry partner, what is their contribution and what is your contribution? So typically, what is the kind of complementary skill set both the parties are bringing together? And based on that, your grant is also, and you need grant to survive in this academic world, right? So that mindset has to be developed into the people. That's all what I feel to say in this one.
Okay, do we have any more responses? If not, we can go to the next question, which is from Anisa Ghosh. And she has a question for Dr. Panda again regarding the breath analyzer. So she wants to say, like, could you please clarify what type of diagnosis is it designed for and the current stage of its development?
I mentioned that as an example of what we are working on. It's at a very early stage. But what we are working on is making an e-nose that is for detecting the spoilage of food. And that is which you're working with a company. It's a joint project. And by next year, we expect it to uh, transfer the technology to the company. And towards the end of this year, we are planning for field trials. And if all goes well, by next year, it will be transferred to the company and they can take it forward. But the point what I would like to say is that when we are developing a sensors, when we are developing our data acquisition systems, when we are developing algorithms, what we are doing is we are not trying to measure, or we are trying to analyze what are the gases which are coming from a source. Now, it does not matter whether it's coming from spoiled food or whether it's coming from the breath. We are now building foundational platforms. And the reason why we are going with this is because it's easy to demonstrate devices which have got much lower regulatory requirements. And food spoilage has a much lower regulatory requirement than, say, a breath analysis for disease detection. And so that is a route we are going in that direction. And also what we are focusing on is the in-house development of the components. As of now, if you look at like gas sensors, at least I'm not aware of if there are any commercial gas sensors which are made in India. Most of them are sourced for outside, but I could be wrong, and I'll be very happy to stand corrected. What you're focusing on is making these sensors based on flexible printable platforms. What it does, it lowers the cost, because that becomes the biggest adder to the bill of materials. So by doing this, we are also looking at other platforms, and we are also looking at other kind of food. That is what we are getting into. And when you look at breath, whether it is, say, for example, gas X, gas Y, or gas Z, whatever is there in breath is also there in, say, spoiled food or somewhere else. So once we are able to demonstrate the working of detecting a particular gas among a mixture of gases with a certain level of certainty, then we'll be ready towards going towards our breath analysis. So that's the plan what we have.
Thank you, Dr. Panda. I think I'll ask another, I would say, more general question for all the panelists. And kind of question is twofold. One is, what are the key challenges you see? I think many of you have already mentioned in somewhat, but I think bigger picture, what do you think are the key challenges for taking the lab scale wearable sensors to the market in India? And also, as these are unique challenges for someone who is entering the wearable sensor space in India, what are most exciting emerging application areas maybe for them to look at if someone is want to start their career? I'm opening the floor for everyone, so please, any one of you can unmute and please.
Okay. Okay.
Go ahead. That's
No,
fine.
no worries. Okay, let me take that one. I might be wrong, but one thing is again driven into the mindset. Like, whenever we are talking, because we do a lot of wearable sensors for profiling your like how is your lung condition, how is your like in line with what Dr. Bhattacharya has demonstrated. Shown. We also recently demonstrated a simple patch-based system which can give you an idea about your arterial stiffness. We published that data, and we got the data mapped with the particular the doctor's results and all those things. So that could give you, and the title of the paper was Prognosis of Cardiovascular Condition. Like this way we projected and published it in a journal called Advanced Healthcare Material. So now we were getting pretty accurate data in that. But whenever you go to the doctor, doctors are pretty correct. They will go by the gold standard. So I think this is a kind of the wearable technology, whatever we are talking about. This is just going to indicate that you are not doing good, boss. You should visit a doctor. Okay, this is going to tell you an indication. Provide you an indication. But I believe if such integration at the hospital level is also possible, like where they have certain screening like facility where using this wearable devices, like for instance, the material that we developed, within 10 seconds, it can provide you the idea whether your arteries are stiff or not. Okay. You do not need to go for any invasive procedure or any like detailed analysis, but at least it gives you an idea. If the hospitals, even if not the mainstream hospital, at least at the primary healthcare level facility, whatever we have in India, if such adaptability is there, I think that will be really great. But the doctors have to also reciprocate well that these sensors are also like something not providing any erroneous data, and it's our responsibility to provide the or make the sensors in such a way that they provide pretty accurate data. So that is something which I feel is something one of the technical challenge that might exist, or I feel it exists. It's my perception. And the second thing to your question, Shubhadeep, is that what could be an exciting field now. This is still in a very niche stage in India. I would say this, if you look, hardly a handful of people do this research on the wearable, electronics in India. The key challenges is the data repeatability and reproducibility. Like you need to have a good like sensors. If you are talking about the sensors, the kind of data that you are generating from there has to be repeatable. The sensitivity, it should perform well. I mean, things should not happen like, if I'm using it Kharagpur, a humid place. Now already the temperature is close to 45 degrees C. It is showing me one data. But when I go to, let's say, into Himachal, because why I'm taking this example, because my first PhD student, she was from Himachal, and she faced real trouble actually when she came to Kharagpur due to this temperature shock. Okay, she recently graduated, she completed her PhD. So this is something like, it should be whatever I do in India, the same if I take that material to US also, the data should come out. So there should be a uniformity in the data. And I believe if one can tune this, there are a lot many scope available in this domain. This is my understanding.
Absolutely with you. And I think there are different levels to this. And, yes, you can have a sensor like it was said, which may break at -5 degrees. It just happens to be a property of something. So that means you literally cannot use it for snowboarding. If you know that, then that's something that you require to communicate. If it does not work at 50 degrees, you probably cannot give it to somebody who happens to be in Rajasthan doing some kind of groundwork or a firefighter or something like that. There are enough numbers of use cases within India with the amount of diversity in the roles and populations that you can definitely make a use case, and you can make something that is very unique to them. And that's one thing. The second thing is almost all wearables are working on a IoT based thing. So you have to end up having an extremely, extremely strong architecture there, an architecture that doesn't break. It doesn't break under 700 million calls a minute. You need to be able to scale sometimes on those. That is something that one doesn't end up thinking about. And that's something that a commercial partner is also thinking about. Sometimes you have prototypes, and we have had prototypes which are amazingly good, but it's just that it doesn't have the longevity to be able to go through all of that, and the reason heats up or something like that happens to it. So it needs to be rugged. It needs to be literally human proof. And it needs to also have a backup of these kinds of data system architectures, because you're at the end of it dealing with health data. You're dealing with data which is going to be important to make decision makings, operationally or something. You have to have those robust architectures. So the two need to meet together, and you have to have that. So there are enough number of use cases within India. Not everything is being taken care of. A lot of these may not be viable commercially and may require government support, but it's something that if you think through all the points, you will probably have a viable product, which even a VC will fund.
Okay. Yeah, thank you. And then the next question is to Dr. Vinu Mahan from Paramita Sarkar. So her question is, can the wearable sensors measure sodium chloride in the sweat? Is there any option for letting the user know of low salt or any possible indication of dehydration?
Yeah, definitely. So many of the that fitness monitoring devices or fitness monitoring prototype devices are developed. It's focused on monitoring, especially from the sweat sample, monitoring the hydration level. Definitely, we have to prepare iron selective electrodes, especially for sodium or chloride or potassium level, or monitor pH level directly from the sweat. So these are indicators for the hydration level. Many companies from US and Europe, they are focusing much on developing hydration-based sensor, and many of them are directly contacting like fitness monitoring institute, like athletes, and many of the athletes are currently wearing these devices and doing for the like tracking real-time data. So definitely it's possible. It's one of the major use of any wearable electrochemical devices.
Thank you, Dr. Mohan, for the answer. And I think now, since kind of we still have some time left, and right now I think I'll provide a question to all of you about the collaboration between academia and industry. I think you have partly mentioned, all of you, in your talk, and also some of you has worked in industry, then moved into academia, or vice versa. But now, as you are in your own roles, how do you see that in next 5, 10 years, the collaboration of different academic institutions, startups, industry players, how they can come together, collaborate, and grow this emerging field in India more, and so that we can have more impactful products come out of India? So any of you, if you can answer.
Well, let me take that first. See, right now, it has been recognized that academia and industry need to come together. And that has been mentioned on several fora. And I think like as you go deeper and deeper into it, you realize that like there's so little you know, and there's so many other uh, expertise is needed in order to get to the goal. So, and now even in India, like there are several schemes which have come up, which promote academic industry, this collaboration. In fact, recently there have been uh, policies which have come up, which are also trying to fund the industry to increase their R&D so that they can also reach out to the academia. So I think as of now in India, those facilitation is happening. So that is at that's at a very high level. But right now, I mean, if I look at it, like once, at least from the academic side, once you have done something, reaching out to the industry is something which I see that there's a lot more reception. We get a lot of reception from the industry. So here we have joint development projects, some things which are developing together. The same time, like some of our technologies have been taken by the industry, and we work towards handholding them. Yes, more can be done from both sides. I think there are challenges on both sides, and we can have another discussion on what the challenges are and what the opportunities are. But all I can say is that like I see that is a very bright side of industry academic collaboration. We ourselves have had some success stories, and there's several more collaborations are on the way, and we hope to see a good chance for good success for that. And I think it's all depends on the mindset of the people involved. If people want to reach out, they'll reach out. They'll go to anywhere.
Anyone else want to add anything on the academia industry collaboration aspect?
I think, like I mentioned in the previous thing, like that is what the government is also wanting. Like, every project is getting endorsed when you have a strong, like, if you look into big projects, whatever is getting funded by either organizations like MITI recently, not only that, actually, they are also promoting to have, to incubate startups. They want startups to also come up. Like, in one of the recent encounter with MITI, it was told to us, like, there should be a startup founded as a part of this whole like project deliverables whatever you are doing. So I think things are in a very positive shape in that way. And needless to say, like without this industry academia collaboration, it is very difficult to take the show light to the product at the end of the day, from your lab to market. If you want to take it and sell it, for an academician it becomes difficult. I'm not telling that academicians are not capable, but they have so many things to do. It becomes difficult to do that. Let the specialist do that activity.
If I may just add one more thing here about NC Flexi, like the KPIs of the in our center include how many technologies have been licensed to the industry? How many industry partners do you have in joint development projects? How many startups have come out from the technologies which have been developed? How many patents have been filed? So, I mean, what I want to say is that, like, okay, when these are some of the examples which strongly promote industry academia collaboration.
Yeah, and I think one of the things that I want to add is sometimes the industry is also looking for a very sustained academia partner. Because you see, you don't just have a single version of a product. You mostly have a 2.0, Pixel is at 9, Apple phone is at 16. You always have to end up upgrading, updating, and being relevant. So sometimes there is a lot of fundamental research which might be useful. You may have had, like in drug discovery, you have 16 candidates which are in early phase. And then out of that, you basically take 5 of them for late phase, and then one of them goes into trial. Similarly, there is a lot of dead end research sometimes, research which didn't go to a publication, or research which didn't go into a product, which can be mined. The point is to be able to find a good industry, academic partner who's able to work with you to understand the product, to understand the product landscape sometimes, and say, hey, we did this 6 years back, it didn't go anywhere, but this might help answer this. And then sometimes those things come back. So it's not just the academia that requires it, the industry also requires it.
Thank you, everyone. Asim, you have a related question in chat if you want to unmute yourself and ask.
We only have 6 minutes, so I didn't want to interject. If there are other questions, I'd rather wait.
No, I think you please go ahead.
I think this is wonderful. It is, especially sitting out here in the US, it's really amazing to see what is happening in India. And as I mentioned, I did some time with Mike Snyder out at Stanford. He's a big proponent of wearables and constant monitoring. One of the things that came up is that constant monitoring sometimes can be a distraction, right? And so you're looking for, how much of AI do you engage? I see a lot of materials development, and there's a lot of talk of AI. How much of it do you engage, and to what use? I mean, to what purpose, right? That's one question. The other question was, there's a massive, how would I put it? It's a massive market, right? The billions of dollars that we're talking about is just a fraction of what is going to come the more we engage with AI. And quite a bit of it is happening here in Israel and Europe, Japan. Now it sounds like even China. How do you engage with industrial partners or commercial entities outside the US? Because the Indian government, I mean, we work with the Indian government quite a bit, right, on the Khurana Bose programs and all that, is very nervous about international engagement. So how would that, I mean, for Indian companies or Indian ideas to develop into products, you need to partner with the players on all over the globe, not even, yeah. So those are the two questions I had, but they're disparate, different questions. So whoever would like to answer, I'd love to hear your thoughts. Let me start with you, Aditi. I see you right there.
I'll take the AI one. Actually, we are doing something on integrating the AI, and we are training our sensors so that I'll be very frank, what our objective is to create a database, train the whole system so that it can have a prediction made what type of problem you are going through. Timely, like for instance, today I got a funding from one of the agency called Indian Council of Medical Research, ICMR. Okay, so for them, I am developing something which is a wearable patch for your cardiac activities and all those kind of thing. So in that, we are integrating the AI model. So definitely from the pattern of your pulse and all those kind of things, basically what we are doing is trying to have a prediction made, like what is the basic condition of the patient on which we
Let me quickly jump in. So something like that I heard about 5 years ago at Stanford. What are you doing differently?
So here we are trying to do like one of the different thing that we are bringing in, like, in India, as you know, it's a very diverse country with different races, different conditions. So those nomograms we are kind of creating like on different features, different places. How is it going to affect like when they put it? And based on that training data, sometimes some people's skin thickness is like, some racial people have a thicker
Skin
skin.
color.
Yeah,
Yeah.
skin colors. So all these things are there. So that is what we are trying to create and kind of, train the whole system.
And so
So,
yeah, please.
no, go ahead.
I look forward to your response.
So there are two questions that you had, and I think I have some responses for both of them. And so we work with a lot of international people. And one of the things that has gone a great way for us is to have our international presence. And because we have a lot of HIPAA compliance, GDPR compliance, etc., those kinds of things, it actually engenders trust because we have processes in play, we have architectures which are going to be important. This becomes very important for an industry partner to actually go from India abroad and to actually engender trust. So a lot of those things have taken a fair bit of investment, and that is something that might be important for anybody with a global ambition. Now, having said that, AI is something that we are constantly having to come against. We obviously, all of us have embraced it in very many different ways. It also comes with a certain amount of skepticism. It comes with a certain amount of handling, and one has to be extremely, extremely sensitive to those. So almost every time that we bring in a new kind of a AI model, ML or deep learning or LLM or something like that, we literally have to have the legal team sit with us and figure out whether these are going to impact existing contracts. Is it going to impact anything else? Is it going to impact anything else that we project? So there is a lot that's going to come in. It's going to get much more structured. And I think that's something that we have to become very important for. One of the things that because we have such a huge, diverse user base, we become attractive for most agentic AI companies. And that is sometimes a boon, that is sometimes a challenge. And it's something that we need to navigate very often. And we are very happy to talk to people who are developing region-specific, India-specific kind of models, etc., which can actually help. Because Indian diaspora is literally everywhere. I mean, I think 90% of the people here are diaspora. So it's not like they are not going into other hospitals and other places where it would be very nice to have a agentic AI, which or an LLM for India, which actually works better. So I think that's something that will have a huge amount. We are 1 in 5 of every human being. So I think it's time that we have something tangible for all of us.
Thank you.
Okay, so we have like only 10 minutes remaining, so we can take only one more question. And that question is to all. Like, if you have any advice to the youngsters who are looking to transit from abroad to India in this field, what that would be?
Okay, it's a very broad question, so let me try to come up with some specifics. See, when you're transitioning from from either US or Europe to India, I think it's important to get your expectations, manage your expectations. That's the first thing I would like to say. India has its challenges. India has opportunities also. It's very important that you come with like what to expect out here. And the second thing would be the pace at which the culture. I mean, there's a difference in the work culture. Uh, it's important to adapt to the local work culture, and that's the best way to move forward. At the same time, like make whatever changes you can. But right now, what I see is when I moved back in 2006, and I've seen a lot of changes since a lot of positives have come out. A lot of things have changed for the good. And make the best use of all the facilities. And especially in the field of wearables, and as was mentioned, India provides a lot because there's a very diverse, we've got a diverse set of people out here from different racial backgrounds, different backgrounds. I think, and having the R&D done right here in India gives a huge advantage, very specifically for this field. And also a lot of strides are being made in different fields. For example, materials research, with biological research, whether it is big data analytics, all the things are like a lot of strides are being made, and I feel that whatever gaps were there between US and India, that's coming down, and hence all these things give a huge advantage to get things going. So for those who are wanting to come back, wish you the very best, and wish you a wonderful career here. And if you want to reach out to any of us, we'll be very happy to share with you our experiences and anything you want to talk to us about.
Thank you for the encouraging words. Then I would ask others to comment on this also. So uh, let's start with Vinu then. Vinu Mohan.
Hello, sir. Yeah, in my experience, after postdoc in University of California, San Diego, and I came back using the fellowship, DST Inspire Faculty Fellowship. And in my experience, it is giving a very good opportunity for young researchers to do independent research, and we are getting like funding 7 lakh per year. It's not very big, but it's better to join with that fellowship with a very good university or with like NITs or IITs having good other instruments. With only that fellowship or with only that 7 lakh per year, we can't do completely independent research. So it's my advice is to join with a very good group. They have all the facilities, and then only we can after coming back to India, we can have within short span of a period, we can publish or we can develop some patents or prototypes, so that we can jump into the next level, like getting a absorbing a good job in a good national or private institute.
Great. Thank you, Dr. Mohan. And then we'd also interested to hear from Dr. Mondal, if you can.
Yeah, I think those who are willing to come back to India actually see, academics is, I mean, to be very honest, when we do the PhD postdocs, we always want, I mean, we all want to sit into the IITs and IIScs or all these places. But, let me tell you one thing very honestly, this is my personal thing, and I also force or rather tell my students, whomsoever are graduating, boss, you should go to an industry and learn how things happen actually. So, because at the end of the day, you need to translate. So, in my opinion, if you are not getting a right academic position in any of these top tier colleges in India, if you are getting a good opportunity in any of the corporate research laboratories, now India have many such examples like so it's always advised to, you can start your career as an industry. In an industry, you learn the industrial things. There are so many things to learn, good practices to be learned in an industry. And then there is always an opportunity to come back with those learning to academia and implement those things, and then you get to see a better output. So, in my opinion, there are multiple paths available. You just need to select it. Industries are always looking for good people. Okay, so that is something which is also very lucrative, and financially that is also much better than this IIT jobs. I can tell you that also. So that is another way you can think of. You can make a lot of money. The lifestyle that you are going to live is pretty good, but at the same time, people have different mindset. Like I had some other vision in my life, and that's why after spending roughly around 4.5 or 5 years close to that, I decided to come to the academics actually. So if you are not, you know, getting right on time any academic position, if you are getting at that time any good industrial position, please go and join it. And then there is always an opportunity to come back, because I believe recent hiring, whatever we are seeing, like there is a lot of, I don't know what happened. the hiring bodies are looking for people who does have this kind of background of product development, have multiple patents and all those kind of things. So that could be an added advantage. So that's what I believe.
Okay, great piece of advice. So then finally we go to Dr. Bhattacharya for your advice or tips, something like that.
I've been both ways. And I think one thing that I'm seeing, which is very good, and that's something that Dr. Mondal did say, is the porosity between the industry and academia is becoming more. If we were talking or having this conversation about 10 years back, the entire structure was very different. There is also, apart from these, you are trained at the fundamental to be an extremely good multi-level analyst. And in case if you don't want to get into any of the hands-on research, product development, or in terms of, foundational research development anywhere, you do have a lot of other openings which do require your skill sets. So I think one of the biggest things that I end up telling people when I look at CVs, which show papers and then they talk about the courses they've done, etc., please restructure it sometimes or look at it yourself and think about three things. One is, what are the transferable skills that just don't require you to be connected to a lab and require you to wear a lab coat, be it in industry or in academia? You may have something. Second thing, if you are able to show consistent improvement or skill development at a cadence of 6 months or 8 months, that is something that becomes very attractive to any kind of a hirer, be it in academia or in industry, showing that you're able to constantly update yourself. And that becomes extremely important. And the third thing is to be able to communicate yourself. Please go out, like suppose if you are in Boston, you are in various other places and all that, you do have entrepreneurial labs, you do have other places where you are having VC pitches, you do have places which are doing communications or even lobbying. You may have a very bright future as a research patent advisor, and that's not something that one should be sneering down their noses at. They earn very well, they do extremely well, and I think it's very important to do other things as well. So please don't have yourself siloed. You never know what's out there for you.
Okay, great piece of advice. And then finally, we will like to introduce our another volunteer, Vaishali, who will tell us about our future events happening this year and to conclude this webinar.
Uh, Thank you, Swanlok. May I first take this opportunity to kindly thank our panelists for this amazing session on wearable devices. I think it was very intriguing to hear insights from both academy and industry partnership and the views on this front. And also, I would like to add a great thanks for the mentors to kindly stay back for an extended time and being interactive and answering the kind questions from the audience out here. And as we conclude this today's session, I would like to bring forth the 8th virtual recruitment drive, which our Cyroid team has put forward with a lot of hard work behind the scenes. So it can help people move back from US, Europe to India. So we have a couple of very interesting participating institutes which have come together and would be interested in hiring people in diverse backgrounds, moving from artificial intelligence, biology, and computer sciences to engineering. So in case any one of you is interested, we would be happy if you would like to kindly register for this virtual recruitment drive. And please be part of this recruitment drive. And following this, we are indeed all the more happy to introduce that we are going to have 10th annual meeting, which will be held partly in US, and on the second venture, it will be held in Europe. So for US, we have Georgetown University, Washington, D.C., and in Europe, we have University of Vienna, Austria. So the event will be from September 10 to 11 in Europe, followed by US from September 13 to 14. So it would be great if you can come in person and attend these interaction meetings, because all the interesting universities would be coming together in person and they would be willing to interact with you. And it provides a great platform to discuss the opportunities of moving back to India in person with the dignitaries and the respected panel members who would come. So with these interesting events which we have lined out, we would like to thank the audience for kindly taking out their time and attending this session. And also a big shout out to the Thyroid team who have taken initiative to put things together for this interesting seminar. And indeed, it is really great to hear the inputs on this end. Thank you to the moderators and the webinar team who have been working on the back end to put everything together. Thank you, and we wish a great day ahead. All the best. Thank you.
Thank you, everyone.
Very much.
Thank you.
Thank
Bye. Bye.
Thank you to everybody. Thank you to volunteers.
Bye-bye, and thank you.
Thank you.
Thank you.
Okay, so well done. Are we joining the other link or is it like closed now? No, nothing.
Let me check. So
Is the YouTube streaming now off?
yes, it's on.
No, it's live.
So I can end it.
We can leave this meeting and we can join the Sunday meeting if somebody has to discuss anything.